Dr. Peter Glidden, your steadfast advocate for health. I'm 59 and a half years old, and I thought I'd seen everything. You know, back in the day when I became a naturopathic doctor, the naturopathic medicine was the redheaded stepchild that nobody wanted to take any responsibility for or even recognize. The profession's come a long, long way in 30 years. And because, you know, I'm open-minded and optimistic, I had assumed that the days of old-fashioned hate and prejudice from a professional point of view were things of the past, relics of the past, but apparently not. They're alive and well, and issuing from the voice box of somebody who refers to himself as Dr. Zdogg. He did a parody of one of my videos and basically slammed, blasphemed, slandered naturopathic medical practice into the bargain, and I simply can't, you know, let behavior like this go unattended to. So apparently, Dr. Zdogg was put off by someone, a medical professional, telling the truth about the statistics regarding cancer treatment and specifically chemotherapy. And you know, in debating school, they teach you when you're taking classes in debating that when you're arguing somebody and you're losing the argument and the facts are going against you, then you devolve into an ad hominem attack. You abandon the facts and you just start slandering. You just start name calling, hurling invectives rather than argue the facts. And, you know, behavior like this is quite frankly childish, and I did not expect it in a medical professional, and yet here we are. So, apparently Dr. Zdogg is only a fan of medical research when it suits his particular point of view. I have no idea what his particular point of view, but here's the research. The contribution of cytotoxic chemotherapy to 5-year survival in adult malignancies. This was published in 2004. It's a study done in Australia, and they took data from Australia and the United States, massive amounts of data, and they did a meta-analysis of it, and here was their conclusion. It is clear that cytotoxic chemotherapy only makes a minor contribution to cancer survival. To justify the continued funding and availability of drugs used in cytotoxic chemotherapy, a rigorous evaluation of the cost effectiveness and impact on the quality of life is urgently required. It's not me saying that. This is published in not naturopathic holistic medical literature, but conventional medical literature, the Journal of Clinical Oncology. I guess Dr. Zdogg doesn't like the facts when they go against his particular narrative. And, you know, like the fella said, you're welcome to your own opinion, but you most certainly are not welcome to your own set of facts. I guess nobody told Dr. Zdogg that to become a naturopathic doctor, a licensed naturopathic doctor in the United States, you have to go through rigorous training. I graduated from Bastyr University in 1991. In order to become a licensed naturopathic doctor in the United States, you have to do 4 years of pre-med, 4 years of naturopathic medical school, fully accredited medical schools, by the way. I guess someone forgot to inform Dr. Zdogg that the reason, if he really even is a medical doctor, because his behavior doesn't deport him, it is unusual for somebody who, in point of fact, is a medical doctor. But my point here is that if you go to high school in Massachusetts and medical school in Pennsylvania, and then do an internship at a hospital in California or whatever, the governing body that allows you to do that, it's not how smart you are. It's the United States Board of Education Academic Accrediting Agency. So they have academic standards so that you can transfer credits from one academic institution to the next, and that's how it works. Here in the United States, I guess somebody forgot to inform Dr. Zdogg that the same accrediting agency, the United States Department of Education that accredited his high school, his college, his medical school, accredited mine as well. So if he has a problem with the fact, he doesn't think that I'm really a doctor, or that my profession isn't really, we're pseudo-scientists, we're not really academically educated, it's a blatant lie, it's incorrect. Because if he assumes that, then he would have to question the United States Department of Education. He would also have to question the legislature of 20 states in the United States, which license and regulate naturopathic medicine, allow naturopathic doctors to prescribe drugs, perform minor surgery, and it's all covered by insurance. I guess someone forgot to tell him that. I matriculated my pre-med at the University of Massachusetts and graduated in 1987 after 4 years with a degree in zoology, Bachelor of Science, which is the program of study for pre-med at the University of Massachusetts. Graduated from fully accredited Bastyr University in 1991, passed national boards, passed state boards, and got my first license to practice naturopathic medicine in 1992. Oh, yeah. Also, I wonder if Dr. Zdogg is okay with the requirement of 25 hours of continuing education credit every year. Most medical doctors are only required to have about 6 or 8 or maybe even 10. I guess these distinctions are lost on the good doctor. Also, let's talk now about the reality of cancer by the numbers. This, not according to Dr. Glidden, but from the American Cancer Society and the United States Centers for Disease Control. This is what happened 2 years ago. Approximately 1,700,000 new cases of cancer, approximately 600,000 cancer deaths. That's 4,620 new cases of cancer every year and every day, every day, and 1,630 deaths. I guess we're doing a really bang-up job with cancer, aren't we? Just doing a great job here. Projected new cancer cases by 2020, 2 million in the year 2020, and we're doing a fantastic job at preventing cancer, aren't we? MD treatment effectiveness, you've got to be kidding me. This again from the Centers for Disease Control. Small cell lung cancer survival rate, 96% of patients who have small cell lung cancer and get conventional treatment will be dead by year 5. Ovarian cancer, 67 patients dead by the 5th year. Pancreatic cancer, 98% of the patients dead after or on the 5th year. Prostate cancer, 69% dead on the 5th year. Rectal cancer, 81% dead on the 5th year. Stomach cancer, 88% dead on the 5th year. Colon cancer, 93% dead on the 5th year. Throat cancer, 100% dead on year 5. That's a great treatment. Non-small cell lung cancer, 96% dead on year 5. Kidney cancer, 92% dead on year 5. And by the way, the American Cancer Society a number of years ago even stopped considering the notion of a cure, and they couched all of their cancer statistics inside of this ridiculous window of 5-year survivability, which means that if you develop cancer and you die from cancer 5 years and 1 day later, that treatment was considered successful. Well, that's a great way to cook the books. Now, look, you don't have to be a statistician. You don't have to have an understanding of how to read a medical journal or understand statistical jargon, research jargon. All you have to do is have a little bit of good old-fashioned street sense. Here's what you have to do. If you really want to get a heads up on what's happening in the wonderful 21st century world of conventional cancer treatment, ask yourself these questions. How many people do you know who have had cancer? Like people in your world, not celebrities, people that you read about, people in your family, people in your church, people in your whatever, your golf club, right? How many people do you know who have had cancer? How many are still alive? Has it been more than 5 years? And how's the quality of their lives? Again, you're welcome to your own opinion, but you most certainly are not welcome to your own set of facts, and you better be very careful when you start slandering my profession. You know what it comes down to, because of the medical monopoly, is something I refer to as compassionate subterfuge and socialized idolatry. Whose heart doesn't go out to a child with cancer, right? You know, whose heart doesn't go out to a spouse who has cancer? So we shave our heads in solidarity with them, right? Whose heart doesn't go out to see kids, you know, with chemotherapy drips and all of this modern high-tech medicine? We think to ourselves, oh, these guys must know what they're doing because they're everywhere all the time, and really, they don't have a clue. While we have given ourselves over to the exclusive care of MDs practicing allopathic medicine, using radiation, chemo, and surgery, the results for cancer are unbelievably poor. We rattle our chemotherapy pill bottles to celebrate our health. It's interesting, you know, because when we take a look at the history of chemotherapy, it started in World War II. They used mustard gas at a town in Italy called Bari, Italy, and the doctors there noticed that the soldiers who were exposed to mustard gas had reduced white cell counts. So these two guys, Goodman and Gilman, both from Yale, oh, they must know what they're doing, used an extract of mustard gas to treat non-Hodgkin's lymphoma, which is a problem with white blood cells, right? This was the first clinical use of chemotherapy to fight cancer, which begs the question, if chemotherapy is so great, then why is non-Hodgkin's lymphoma still around? But, you know, let's not pay too much attention to the bare facts. Let's just go out of our way to slander a medical profession which is not our own. And this is what the medical doctors are famous for. The American Medical Association in the mid-'80s was fined $25 million for a slander suit because they had been slandering the chiropractors for 10 years. And they were found guilty in federal court of promoting a slander campaign. Oh, don't go to those chiropractors. They're quacks. Don't go to those naturopaths. They're quacks. When the facts are going against your side, well, I guess the best thing to do is try to slander the competition. Let's not even talk about chemotherapy side effects. You've got to be kidding me. And let's not even talk about the money. Did you know that chemotherapeutic drugs are the only class of drugs that the prescribing doctor gets a cut from? Did you know that? If you go to a medical doctor with a sore throat and get an antibiotic or a blood pressure medicine, the doctor doesn't get paid for that. You pay the pharmacist, right? The drug company gets the money themselves, the pharmacy. Not with chemotherapy. Chemotherapy is the only class of medications where the doctor who prescribes it gets a direct piece of the pie. And here's how it goes. Kinda, sorta. The oncologist orders the chemotherapy drug from the pharmacy, pays $2,000. I'm making these numbers up, but they're pretty close. Buys it for $2,000, sells it to the patient for $10,000. The hospital and the oncologist split the difference. Oh, no, but you know, with that, though, that's perfectly fine. It's perfectly fine for the oncologist to do that. And pay no attention to that, ladies and gentlemen. It's a naturopath that's a quack. He practices pseudoscientific medicine, not a real doctor. I think it's time for Dr. Zdogg to go sit at the children's table, quite frankly. All you have to do is follow the money, for goodness sakes. Conventional cancer treatment is a failed methodology. Conventional treatment for trauma is fantastic. Thank God for Novocaine. Thank God for the sterile technique. Thank God for antibiotics. But conventional treatment for cancer is a failed method, and I'm the only one standing up and saying it. Well, not the only one. Here's the drill. Your medical doctor may be the nicest person on the earth, nicest person that God ever created, but your medical doctor doesn't practice medicine. Your medical doctor practices allopathic medicine. I practice naturopathic medicine. There are academic differences here that we can debate civilly. My profession's not perfect, but calling it non-medicine, calling me a non-doctor is quite frankly childish, and I expect more from a medical professional. By its nature, allopathic medicine is oppositionally defiant. medicines are given to exert a hostile takeover of the mechanisms of the human body. Sometimes this is a good idea. That's how the medicines got their name, by the way. Antibiotic, antihypertensive, antacid, etc. Allopathic treatment of cancer attempts to kill the tumor, right? They dissolve the tumor with chemo, they burn the tumor with radiation, or they slice it out with surgery, but the tumor isn't the disease. The tumor is the result of the disease. When you kill the tumor without removing the cause, guess what? It comes back. I'm back. And this is the biggest problem with cancer. It's not that difficult to eliminate the tumor initially, but it always comes back and then you die from it. And when it comes back with a vengeance. See the 5-year survivorship right there? And that's why they did it, right? Because, if they took it out to 10 years, then it would be everybody's dead from cancer, for goodness sakes. So let's review. We haven't had a free medical market since 1912, when Congress granted the American Medical Association exclusive control over who could and who couldn't practice medicine. The homeopaths, the naturopaths, the herbalists, the chiropractors, everybody but the MDs was kicked off of the bus of medicine. And the medical doctors legislated themselves into first place. That's why they are in first place. It's not because their therapeutics are better than mine. It's because they exerted a hostile takeover of the system of medicine in 1912. It's a historical fact, Jack. The only branch of medicine that cancer research and treatment goes to, by and large, is MD, allopathic medicine. Allopathic treatment for cancer delivers statistically horrible results with horrible side effects at a huge profit to the industry with a huge incidence of recurrence. Let the buyer beware. It's pretty simple. 10 questions that every cancer patient should ask their oncologist in the presence of a witness and a recording device. So, look, if some knucklehead like Dr. Zdogg wants to actually have an intellectual conversation with me or any other naturopath, an academic debate over the facts, no problem. But when you're just going to hurl invectives, whatever the term is, going to hurl insults at the opposition because they're saying something that's uncomfortable, that creates cognitive dissonance in your tiny little brain, well, I would counsel you not to do that again, because there is such a thing as slander and probably a violation of professional ethics. Again, I think it's time for Dr. Zdogg to go sit at the children's table. I am and always will be your steadfast advocate for health, Dr. Peter Glidden. God willing and the creek don't rise, I'll see you around campus.